Did you know that every minute counts when it comes to a stroke? It's one of the leading causes of death and disability, and the worst part is, most people don't even recognize the warning signs in time. The window for effective treatment is incredibly small, just 4 hours. That's right, 4 hours to save your brain from irreversible damage. But how can you tell if you're having a stroke? Imagine this. You suddenly experience a severe headache, feel dizzy, or your vision goes blurry. You try to speak, but your words come out garbled. You feel your face drooping, or one arm feels numb. These could be early warning signs, and the clock is ticking. If you don't act fast, the effects could last a lifetime. But here's the thing. It's not just about recognizing the signs. It's about knowing exactly what to do when it happens. Most people have no idea how critical the first few hours are. Do you? If you wait too long, your brain won't recover, and the damage can become permanent. In the next few minutes, I'm going to share with you the simple but life-saving actions you can take to improve your chances of recovery if you or someone you love ever experiences a stroke. This information could be the difference between life and death, or between a full recovery and a lifetime of disability. Stay tuned, because what you do in the first 4 hours matters more than you could ever imagine. Stroke is one of the most terrifying medical emergencies. It happens when the blood supply to a part of the brain is cut off, and it can happen to anyone, anywhere, at any time. The reality is that stroke can happen suddenly, without any warning. But there's one critical thing you must know. If you act quickly, you can save yourself or your loved one from the devastating effects of a stroke. Time is of the essence when it comes to stroke treatment. If you or someone around you is having a stroke, you must act quickly. Why? Because after just 4 hours, your brain can experience irreparable damage, and the chances of a full recovery decrease significantly. Every minute that ticks by without treatment can cause more harm to the brain, making it even harder to recover. This is why early intervention is the key to survival. In this video, I'm going to walk you through what you need to do the second you notice the signs of a stroke. You'll be armed with knowledge that could potentially save a life. We're going to go step by step through the critical actions that need to be taken within the first 4 hours of a stroke. The first step is to recognize the signs of a stroke. It's critical that you know what to look for. The symptoms of a stroke come on suddenly, and they may include sudden numbness or weakness, especially on one side of the body. You might feel one side of your face drooping, or you might not be able to lift one arm. Confusion or trouble speaking. You may slur your words, or you may have difficulty understanding others. Simple sentences may seem impossible to grasp. Sudden vision problems. Blurry or double vision can strike without warning. You may only be able to see clearly with one eye. Severe headache. A headache like no other. It comes on suddenly and may be accompanied by dizziness or vomiting. Dizziness or loss of balance. You might feel like you're spinning, or you may be unable to walk without falling. If you notice any of these symptoms in yourself or someone else, don't wait to see if they improve. Every second counts. Once you recognize the signs, it's time to act fast. Here's what you need to do immediately. Call emergency services, 911 in the US, 112 in Europe, or your local emergency number. The first thing you need to do is call emergency services. Time is so critical that every moment you wait can increase the damage to the brain. Even if the symptoms go away, you still need to call. A transient ischemic attack, TIA, can mimic a stroke, but go away, but the risk of a full stroke is still there, so always call for help. Don't hesitate or wait to see if it gets better. Make a note of the time symptoms started. When you call emergency services, tell them the exact time you first noticed the symptoms. This information is vital because it will help doctors determine the best course of treatment. For example, some treatments like clot-busting drugs are most effective when administered within the first 4 hours of the stroke, so knowing the time can be life-saving. Do not let the person sleep or lie down. If you're with someone having a stroke, don't let them fall asleep or lie down. Keep them awake and as alert as possible. Keep them in an upright position to prevent further complications, such as choking.
Administer medication if directed by healthcare professionals. If medical professionals advise, administer the prescribed medication. However, you should only do this once you've spoken to a doctor. If someone is at risk of a stroke and has been prescribed blood thinners, ensure they take the medication only as directed. Stay calm. During a stroke, it's easy to panic, but the person affected needs you to stay calm. Keep them as relaxed as possible and reassure them that help is on the way. Emergency treatments. When the person arrives at the hospital, doctors will perform several tests to determine what kind of stroke is happening and how to proceed. There are two types of strokes, ischemic and hemorrhagic. The majority of strokes are ischemic, caused by a blood clot that blocks the flow of blood. These are treated with clot-busting drugs if administered within 4 hours. For hemorrhagic strokes, where bleeding occurs in the brain, doctors may need to perform surgery to stop the bleeding and relieve pressure on the brain. The faster the treatment begins, the better the outcome. If the stroke is caught early, the person could recover with minimal or no permanent damage. But the longer you wait, the harder it becomes to reverse the damage. Once the initial treatment is completed, recovery can begin. However, many stroke survivors face long-term challenges such as speech difficulties, mobility issues, and cognitive impairments. The good news is that with proper rehabilitation, physical therapy, speech therapy, and cognitive therapy, many stroke survivors can regain much of their function. If you ever find yourself or someone else in the middle of a stroke, remember, time is the most important factor. The first 4 hours could be the difference between life and death, or between a full recovery and a lifetime of disability. Recognize the signs, act fast, and always call for help immediately. A stroke is a medical emergency, and it's up to you to act and decisively. The knowledge you now have could save a life. Share this video with your friends and family, because when it comes to stroke, it's not just about knowing the signs, but about acting in time to make a difference.